Okay, what we're going to, the next presentation is by Robert Claar, and Robert is a business person who's a long-term resident of Japan, and he's here to give you a bit of an overview from the perspective, if you like, on the ground, of how this country is responding to aging. As you know, Japan is one of the oldest societies on Earth. I think it is the oldest society on Earth in terms of its average. And so we're going to look at how, of course, it's a bit of a canary in the coal mine, and how it's responding to this position. Rob, the title of this is Japan's a Role Model for Ultra-Aging Societies, Innovation and Sustainability in Universal Access Healthcare. And Rob creates new businesses that address the unmet needs of patients, doctors, innovators, regulators, and payers. And he is passionate about developing innovative solutions for access to Japan's healthcare market. Over 3 decades, he has founded, managed, and exited a number of healthcare businesses in Japan, Europe, and the United States, including Junicon, a global healthcare marketing research consultancy that developed Japan's first comprehensive key opinion leader physician database and pioneered in-hospital observational research. And Vorpal Technologies, a regulatory consultancy that achieved the leading position in Japan for new category medtech approvals. He maintains a worldwide trust network with leading innovators in medtech and pharma through optimism, tenacious follow-through, and a spirit of collaboration. I first met Rob through a mutual friend, Lowell Shepherd, where he served on the board. I actually used to serve as a trustee of the Hope International Development Agency here in Japan, and he's well known and respected as a business and charity leader, and I welcome him today. Rob Claar.
Thanks so much, Joe. Thanks to the organizers for inviting me. I don't often get the pleasure of speaking at an academic conference, so this is new to me. I'm delighted to be here. Thanks. So how many people are living outside of Japan and have arrived for this conference? So you're not a resident of Japan. Okay, so as Joe said, Japan is the highest aged society in the world, so welcome to that environment. And I'd like to give you some facts and figures and opinions on how Japan can be a role model for the rest of the world, which the developing world is closely following in terms of becoming ultra-aging societies as well. So I'll quickly introduce myself. I'll talk about some of the facts and figures about Japan, and then propose some solutions going forward. So I've been here actually, I came in 1987 with the intention of staying for 1 year, and it's a lot of time has passed, so I'm staying and enjoying myself. So I've been an entrepreneur for 30 years, creating new businesses in Japan in the healthcare space. I graduated from school in the United States and came right over afterwards. I'm also, in addition to business, involved with an international school and also the Hope International Development Agency, which is doing clean water projects and education in Africa and Asia. So on the business side, I am currently the CEO of HekaBio. What we're involved with there is in licensing great medical innovations from around the world and bringing them into Japan. Before that, I was involved with Vorpal Technologies, which is a clinical research organization. And what that does is we run clinical trials or do regulatory approvals to get new innovations coming into Japan. For 10 years, we're very happy to have brought in the most new medical technology approvals over that decade. And Junicon, which is a what do you call it? Primary market research consultancy, we would say. And then I got my start just after college working at a think tank called Sanwa Research Institute Corporation. And a very academic environment there, extremely interesting. Just by chance, I was given the opportunity to travel all over Japan and meet doctors and understand what are their needs, what do they see as requirements for new innovations coming into Japan, what are the challenges that they have in their business and their day-to-day operations. So that's where I come from. So just quickly on the company right now, what we do, 3 different things every day: identify great innovations, invest in them, and bring them into Japan. Very simply put, that's what we're up to with our mission of empowering patients. So we feel that innovations are needed in Japan, not only for clinical benefit, but also for health economic benefit. And we bring those in through the core values of collaboration, creativity, and commitment. We've already amassed a portfolio of 8 programs in 4 different areas: cardiology, neurology, oncology, and ophthalmology. And we'll continue to grow that portfolio, hopefully for the benefit of not only business and our investors, but also for societal benefit. So let's talk more about some of the facts around Japan. I'm sure you don't need me to tell you this, but Japan has 30% of its population 65 or over. And so this is actually, as Joe had mentioned, the highest aged society on the planet, with actually one exception of Monaco, but let's talk about major populous countries. And so we see that, and we had a discussion yesterday about Korea being even faster aging than Japan. Korea has some catching up to do, but there's many countries around the world that are going to become quickly, due to lowering birth rate, due to longer longevity, will be following Japan's example. Right now, the number 65 and over is 30%. And that's an important to keep in mind. In the G7 countries, the closest country after Japan is a full 6% behind on that. So, and Japan also is the world's best, in my opinion, best performing national healthcare system. We have great longevity, we have great healthy life expectancy, and these are OECD numbers which peg the GDP percentage of healthcare expenditure at over 11%. Our numbers that we're using from the Japanese data and using sort of year by year yen exchange rates versus dollars, we come up with something around 9% is more accurate. But keep in mind that Japan produces the world's greatest results with a reasonable budgetary expenditure. And we need to keep that up. So this is the slide that keeps the government up at night. We see we're in the middle, right around the middle there in 2024, where in dollar terms, Japan is spending $400 billion on healthcare. This includes about 30% of expenditure is drug prices, device prices, these kinds of things, and the rest is services. So you would think that services is going to be the best target for cost savings. The government, I think all governments will look at the low-hanging fruit first for how to save costs. So they look at drug prices, they look at device prices. But a bigger story, we believe, is in terms of how to streamline, how to make more efficient the delivery of services across the system. And as we know, when people age more and more, they're normally going to cost the healthcare system a greater percentage, or the per capita expenditure on healthcare is going to increase. So really the key to Japan is the next 10 years. If you look until 2035, we see an explosion in the population over 75, and particularly the population over 85. So this is what's got the government very concerned. How do we continue to provide universal access, single-payer healthcare with great results, even though we've got a declining working population that's paying tax revenue into the system that makes it work, and we've got a greater number of people who are beyond working age and requiring greater levels of service. there's another aspect to healthcare. It's included in the 400 billion yen expenditure, but that's the outside of hospital services, which are known as long-term care. So if we look at, there are some recipients of long-term care services that are below 65, but let's just look at the 65 and over population and the number of people that are accessing this. Long-term care might be home visitation nursing. It might be in-facility care. There's a number of different ways that this gets deployed, but taking a look at this is helpful. So we see a rising percentage here. And this also has the government concern because of some infrastructure situations that I'll explain in a moment. And the cost of long-term care for those 65 and over is also on the rise. So if we see here in 2020, we've got of the $400 billion of overall healthcare expenditure, about 25% of it is going to long-term care for those over 65, so outside of the hospital care. So this is a concern. At the bottom of the page, it may be a bit of an eye chart here, so not so easy to read, but the main message that we want to put here on this page and introduce is that the government has a few different levers for saving the budget. Number one is, how can you increase the number of people in the workforce who are paying tax revenue into the healthcare system? Well, one way is raise the retirement age. Another way is increase immigration. Another way is to lower costs by increasing the copay. So it used to be that if you're 70 and over, all medical care is free. Then it turned to 10%, and then in some cases it's turned to 30%. So the government is making tweaks to the copay in order to make sure that the system doesn't get overwhelmed. For example, outpatient hospital visits. Now, in a universal access system, theoretically, you could go to any university hospital in Tokyo here, there's a few, and you could walk in and get seen by a specialist. You don't have to wait in line, go to a general practitioner, and then go up the chain and a month later see a specialist. No, you can walk into a university hospital and see a specialist on the same day. You could also, if you wanted to, you could go across town to another university hospital and do the exact same thing. Now, eventually someone's going to catch that and not pay so that the universal healthcare system is not paying for both services. That will eventually get caught. But the access is amazing in Japan. So how to prevent people from overusing it? Outpatient visits are in decline here, despite the fact that the population has increasing in the 65 and over category because of the increase of copay. Hospitalization incidence also is going down. So you can see back in 1987 when I first got here, if you're 65 and over, you could pay 300 yen. You could pay about, in today's dollar terms, about $2 a day for a hospital bed overnight stay. That's a lot lower than the hotel fees that you're no doubt paying. So obviously the government couldn't sustain that, so they increased the copay on hospitalization as well and have succeeded in reducing that. Another issue is the infrastructure. So physical infrastructure as well as human resources that are able to provide the services needed. This is an important one because actually, overwork in hospitals is a very serious situation in Japan. Japan really cracks down on companies that overwork their people and force them to work too many hours overtime. You could get labeled as a black company if you're doing too much overtime. Hospitals actually got a buy. They got a pass on that regulation, and they've gotten until actually next week to resolve their situation. So April 1, now hospitals are going to be regulated the same way as everybody else, making sure that overworking is limited and regulated against. So if you look at this chart, you'll perhaps assume that Japan has just about as many doctors and nurses as it should have. It's right there in line with the USA. Germany has a bit more, but this is normal range. All good, right? Actually not, because even though through the copay mechanism, Japan has reduced the number of average hospital visits, people in Japan go to visit a doctor 11 times a year on average. So if you look at the United States, it's 3.5 times more doctor visits per person on average than the US does. So we've got normally good enough human infrastructure in hospitals and clinics, but too many people visiting. And what about the hospital beds? Well, the same. So Japan has a huge amount of infrastructure and hospital beds. The United States, it's four times the amount of hospital beds per capita that the U.S. has. So now you've got a similar workforce in the hospital that needs to cover 3.5 times the number of visits and 4 times the number of beds. So now you can understand why we have the overworking and understaffing issue here. Now, Japan has done a pretty good job of reducing the number of hospital beds in Japan over the time. So just by tweaking that copay, you get less people coming in. Now hospitals are shutting down and clinics are shutting down the number of beds that they've got. So really reduce that dramatically, but still far more than every other country in the G7. When I first got to Japan, the number of hospital beds per capita was actually twice what it is now. And the number of facilities with hospital beds, including clinics, which is defined as under 20 beds, and hospitals, which is 20 and over, the number of facilities with hospital beds in them is now half of what it was in 1995. So getting more rationalized. Long-term care workers is also a big issue in Japan. So we have right now 2.1 million people, nursing staff working in long-term care. With the explosion of the aging population, more and more workers are needed here. These are government figures projecting what is the shortage now and in the future of workers for long-term care. And they say that today we've got 220,000 people shortage. That's going to grow next year to 320,000 shortage and eventually to 700,000 people shortage. So this is a problem to how to manage the very elderly when they need outside of hospital care. Well, one way is immigration. So Japan is doing a good job, and you see in the news here just about every week a new category of visa that Japan is offering. Investors, business people, special technical visas, etc. And one's also related to long-term care and nursing care. So there's a lot of ways to get into Japan now to encourage that adoption of people working in the long-term care field. This is what that looks like in terms of foreign people coming into Japan to help solve the gap in the nursing care field. But 17,000 is not 700,000, and we need to continue to solve that gap other ways, either through immigration or through potentially wage mechanisms to encourage also Japanese domestic people to get into this field as well. Now, of particular interest to me is the role of innovation, because that's what we do in our business. So we look at how can we bring in innovations, not only that are great in terms of the clinical benefit, but also the health economic benefit. What can be done to bring in great new solutions that save money? This is the role of our company, so my particular interest. Now, this one is also in the news at least once a month. We see Japan has this innovation gap. Now, if you look at the results of the healthcare system, you'd say, hey, maybe the innovation is just good enough because Japan's got the longest longevity, it's got the longest healthy longevity. What more innovations could you possibly need? Well, that's one way to put it, and we would agree to a degree. But when we look at the number of new drugs on the left-hand side of this chart that are approved in the US and Europe, and look at that versus the number of drugs approved here in Japan, we see that there's a gap of nearly 200 drugs that are not available here. So when we go around to hospitals and talk with doctors, there's a lot of concern there. There's a lot of concern in the government as well, particularly for rare disease, for orphan diseases, for pediatric diseases. Where there are not enough companies here in Japan who are developing those drugs in order to get them into the hands of the doctors and patients. This is an issue. Now, we were surprised to actually take a look at something that's less well known, and that's on the right-hand side here. These are the number of new category or novel medical devices that are approved every year. In the FDA, US only, there's annual approvals in the FDA in the blue line. They changed their regulation associated with submissions in 2019, so there's a bit of a downturn there, but the trend, as you can see, is continually going up. In Japan, we actually have fewer and fewer new category medical devices that are getting approved every year. To me, this is shocking and something that needs to be turned around. So here's some ways that I believe Japan can solve the innovation gap. Digitization. So we need to get Japan thinking away from just drugs and devices and how they can lower the costs of drugs and devices, because the more you do that, it means that foreign companies or entrepreneurs like myself are going to be less motivated to develop that new drug, to get it into Japan and get it available. So we need to encourage the government to focus in other areas. Look at the 70% of healthcare costs that's actually not drugs and devices, but it's IT. So look at digitization. Here's an issue that you may not know, but if you think of a single-payer universal coverage healthcare system, you might think that Japan probably has perfectly available data across the system. However, I could go into one hospital and I'll be connected to their electronic medical record system, which is connected to no other hospital's electronic medical record system. So I have a collection of, I almost never go to the hospital anyway unless I'm meeting my doctor friends, but I've got this collection of about 10 different clinic and hospital cards that I've gone to over the years. So you go in and plug it in and it connects to the electronic medical record. Those do not talk to each other. Eventually, there will be some communication between all those systems because someone at the medical facility is invoicing them to the government. The government has some data, but it's not searchable to anybody else. You would think that Japan could do a lot more in terms of overall visibility and transparency of data, and that would also help with hospital management and efficiency. Also, regulation. Japan recently, over the last couple months, has come out and said, we no longer require phase 1 clinical trials for Japan. So you can start with phase 2 as long as you've got a properly executed phase 1 clinical trial elsewhere. This is big news because it saves 3 years and $5 million off of any program. This is wonderful news. So now all of a sudden, it's almost as fast to develop a drug as it is a device. This is great news. Preclinical requirements, they could still do some work in eliminating the requirements there, in my opinion. And the key one here is pricing transparency. So if you are beginning to work on a medical device or a drug, you come in, you do all the work, clinical trial, you'd submit to the government, and then they give you your approval. Now, you need to submit for pricing reimbursement. But you don't have a promise from the government what your pricing is going to be until the very end. So you could be spending 5 years on your development. Now you submit to the government, 1 year later you get your approval. So a lot of time and money has passed, but you have no promise from the government what the reimbursement price is going to be. So this is what has a lot of people concerned. In my view, if the government could provide pricing transparency in such a way where it could be a collaborative process, whereby the government says, if you can produce this kind of benefit, we will give you this type of reimbursement price. This would do a lot to solving that innovation gap. So I'm a Japan optimist. And I believe that Japan does have the best healthcare system in the world. I know for sure that Japan wants to maintain its top-performing universal access, total coverage system within the ultra-aging population without reverting to an idea where people with money get better care, people with less money don't. That's the disaster scenario for Japan's policymakers. They want to make sure that universal access continues, and they want to make sure that the results continue to be great. I also believe that solving these issues with increasing transparency and efficiency, Japan will be able to be a beacon for the rest of the world as ultra-aging kicks in and follows Japan's example. Japan needs to grow the overall number of workers through immigration, limit overutilization of healthcare services by increasing the copay, but hopefully not too much, because you don't want to reach that tipping point where people who can't afford it are not able to go. By the way, speaking of affordability, Japan also has a very nice mechanism whereby if you get a disastrous diagnosis, you're never going to end up in the poorhouse for having that diagnosis. So there's actually an annual cap of about $6,500 on what any person would have to pay out of pocket on the whole copay. So, you compare that with other countries around the world, it's quite a nice cap. Change the setting of healthcare utilization to outside the hospital, where the costs are less. Also, we need to achieve reduction in the number of hospital beds, which Japan has done well, but there's a lot of work still to do, particularly to prevent the healthcare worker overload. Growing the number of long-term care workers through more immigration policy relaxation and improved compensation to encourage more people to get into that field. And the improvement of pricing transparency will help to boost the innovation. And that's it.
Fantastic, Rob. That was a great briefing, I think, for us all on that touched on a number of things, and I'm sure people will have some things that they'll ask. We have just a time for one question. Do we have a quick hand? That's right at the back. I recognize that shirt.
Hi, thank you for that. I just had a question. Japan seems to be innovating in the healthcare industry beyond bounds here. The one question I had is, how come they haven't adopted the advanced nurse practitioner as a frontline worker in the medical system?
Oh boy, that's a big question. Japan does have categories of specialist nurses, which was introduced in the 90s. And so there are different categories of nurses that then have the ability to do certain new interventional practices that used to be reserved to doctors. We had a similar issue, by the way, in ambulance workers, where if you're in an ambulance, the emergency medical people were not able to do many things that you would expect them to be able to do until the patient got to the hospital. And in some cases, it's too late. So there's been some relaxation in that area too. Short answer is the Doctors Association wants to keep doctor activities to themselves, and they're very strong in terms of their lobbying ability and connections to the government. So I think change there is going to continue to take time.
Okay, we'll have to leave it there, but thank you very much, Rob, and please join me in thanking him.